Good morning, everyone, and thank you for joining us today, Tuesday, March 31st, which is the Transgender Day of Visibility. This is our first attempt at SASOD of having a virtual media engagement. So I'm going to ask you to bear with us as we troubleshoot some of the technical issues. Before we get started proper, since a virtual press conference might be new to many of us, I just wanted to go through a little bit of housekeeping first. For the folks on Zoom, we're going to ask for the first period before we get to the Q&A if you can keep your mics muted. So that way, if there's any background noise or anything like that, it won't be picked up. And when we get to the Q&A and you're ready to speak, you will then unmute your mics. In terms of a format for this morning's virtual launch, I will make some brief introductory remarks. My colleague, Alessandra Hirimon, will make the substantive presentation of the findings of the study. And on Zoom, joining us from Kingston, Jamaica, is the Executive Director of the Caribbean Vulnerable Communities Coalition, Mr. Ivan Cruikshank, who was our technical service partner in executing this study. He will give some reactions to some of the findings and recommendations that we've made on the study. I'm being asked to look at the camera and not look at the laptop, which is instinctive for me because I feel like I'm talking to the folks on Zoom. So I'll make a special effort to do that. As all of you would have known from the media alert, the media bulletin that went out, the presser is being audio and video recorded. For the folks working in broadcast media, we will be able to send you audio and video footage upon request. And we also have photography in-house to get a couple of shots here for the folks working on press and on the internet who would need photographs. Our technical service providers today are the University of Guyana's Center for Communication Studies, and we want to thank them for coming out and supporting us this morning. I'm going to ask my colleagues to just put all the phones on silent so we don't hear all the WhatsApp alerts during the recording. And I think there's somebody on the call who might just be joining us, who might have missed the little Zoom call etiquette. And we just want to alert you to mute your mics and turn on during the Q&A. Right? I think we have a new person joining us. Right, sounds like a familiar voice. Might that be Abina Rockcliffe from Guyana Standard? I'm not sure. Thanks. But we'll get straight into the meat of the matter now. Today, Tuesday, March 31st, marks Trans Day of Visibility. And while the world is, including Guyana and all the Caribbean, are facing a global health pandemic, SASOD Guyana, Guyana Trans United, and our local partners would usually celebrate this day with a lot more extravagance. GTU, for one, had planned a walk, which had to be canceled. And this has been an annual walk for Trans Day of Visibility. But we thought to ourselves, given this recent study that we've just completed this month, it would be a missed opportunity if today on Trans Day of Visibility, we didn't take this opportunity to share the findings and the recommendations of what I call in short the Guyana Trans study, because it's really the first of its kind in Guyana and the Caribbean. But the long title is Desires for Care and Access to Services Among Transgender Persons in Guyana. Trans Day of Visibility is a day for celebrating transgender people and raising awareness about the forms of discrimination that they face, and also acknowledging their contributions to society in general. And I think this research project does all three of those things. By way of a bit of a background, we recognized in our work that there was no real research on trans issues in Guyana and the English-speaking Caribbean. And we really didn't have an evidence base for comprehensive interventions related to care and access to services for trans people in Guyana. So in our ambitions at SASOD, this project has been a goal of ours for the last 3 years, and it finally came to fruition this year through an opportunity provided by the Global Fund's Community Rights and Gender Special Initiative, which supports efforts like these to gather strategic information. The study is conducted by SASOD Guyana in collaboration with Guyana Trans United. And through the financial support of the Global Fund to fight AIDS, tuberculosis, and malaria, we have also had technical assistance from the Caribbean Vulnerable Communities Coalition, which is a regional organization working with vulnerable populations based in Kingston, Jamaica. And today here at this virtual media launch, we have all 3 partners involved in this research project, all 3 civil society partners, SASOD Guyana, GTU, and CVC participating. Without further ado, I'll introduce my colleague, Alessandra Hiriman, who was the local consultant and co-author of the study. And she worked alongside SASOD Guyana's public health consultant, Dr. Nastasia Rambaran, who is based in Barbados and might actually be on the call with us this morning as well. So I'm now going to hand the mic over to Alessandra to present the methodology, findings, and recommendations of the study.
Thank you, Joel. Good morning, everyone. I'll start with a brief overview of the research title and the methodology. As Joel mentioned a few minutes ago, the title of the study is Desire for Care and Access to Services Among Transgender People in Guyana. A qualitative methodology was adopted for this study. Semi-structured interviews were conducted with 22 trans and gender non-conforming persons from 4 regions in Guyana, along with stakeholders interviewed, to gain a better understanding of service barriers encountered by trans persons and subsequently help guide programmatic decisions. All interviews were transcribed, coded, and analyzed thematically. Today, I'll share some of the major themes that emerged from this research. The first theme I want us to look at is gender identity, expression, and sexuality. There was an initial confusion about gender identity. For example, when participants were asked to describe their gender identity, a lot of persons made reference to their sex assigned at birth. Similarly, when participants were asked to describe their sexual orientation, 7 persons said trans, confusing a gender identity category with sexual orientation. However, after some conceptual definitions were offered, some participants were better able to describe their gender identity and sexual orientation. 18 persons identified as trans women, 3 as trans men, and 1 person as gender non-conforming. The largest sexual orientation category was homosexual or gay, which was chosen by 6 of the participants. Many persons knew their gender identity from an early age and exhibited gender non-conforming behavior. Almost everyone had experiences of stigmatization and harassment because of their gender identity, and this occurred across a range of spaces, for example, public, private, and professional. Experiences include discrimination in seeking job, neglect or being ignored when seeking healthcare, police harassment or abuse. 3 persons mentioned challenges in using public transportation, for example, assault or being put out of the public transportation. And there were also experiences of violence from community members and intimate partners. In relation to the trans experience, there were factors that either increase a trans person's risk for violence or probably kind of mitigate or prevented that violence. So for example, when we looked at factors that increase violence and discrimination for trans persons, Persons were more likely to experience violence if they were rejected by family, grew up in a hostile community, have no sense of LGBT community. If they engaged in sex work, other factors that increased their risk for violence included moral and religious belief and general ignorance within the society. Conversely, protective and mitigating factors against violence and discrimination included being in a professional and working environment, higher education, having supportive families and teachers, established familiarity with institutions and actors. This, for example, is if, for example, someone is in care and they would have accessed care and treatment at that institution for, let's say, 2 or 3 years, they would have established some familiarity with the institution and actors. So the more openly form of discrimination is low in that case. Another factor that prevented stigma and discrimination against trans people was when they had a sense of LGBT community, solidarity, and a sense of belonging within the community. In relation to HIV care and access to HIV treatment, all participants had sexual experience, with trans women having had male or mostly male partners, while trans men and gender non-conforming persons reported female partners. All participants had been tested for HIV in the past, and approximately 1/3 were living with HIV and in care. Persons living with HIV relayed their experiences in treatment and care, which included issues with medication and adherence, such as side effects and medications being stolen, long waits, authoritative and patronizing staff, and discriminatory procedures, such as one specific social worker dealing with people living with HIV, thus making identification of status easy. Suggestions for improving testing and care were, with most agreeing that pairing either HIV testing or HIV care with hormone provision. Other suggestions included educational workshop for trans persons on why they should engage in HIV services, having more LGBTQ-friendly and inclusive spaces, and integrating HIV testing and care with general medical services. When we looked at the desire for gender-affirming care, most persons had not legally changed their name, although many were using non-birth names. Some wanted to have a name change, but were not aware of that process. About half the participants had access to mental health counseling or psychotherapy, and for 2 of those, it was a bad experience or unhelpful. In this case, it demonstrated a lack of gender sensitivity in the work that some social work and psychologists do. So for example, one of the experiences, a trans man sought psychotherapy from a social worker, and instead of being encouraged or discouraged from starting hormone therapy or seeking out service, and because of that bad experience, it prevented them from further accessing counseling. Most persons would change their gender marker if they could, and 1 person had successfully done so on their NIS document. 7 persons had either used hormone in the past or were currently using them. All of these medications were bought over the counter without professional guidance from doctors. A minority of trans women wanted vaginoplasty, with others either definitely saying no to the option or being undecided, while a majority of trans men wanted chest surgery. Barriers to gender-affirming care included either the availability of the service, affordability of the service, lack of awareness of these services, fear of family or situation. An example of this is one trans woman was afraid to start hormone therapy because of the changes that would be visible and how her family would react to that. And also, as I shared earlier, because of bad past experience, it acts as a hindrance in further seeking services. This study supported the global narrative that trans people remain one of the most marginalized groups in society with very limited access to economic and social resources, despite having increased visibility in the media and public spaces. The findings also suggested strategies that can be used to change this present narrative in our very local context. For example, education and training of service providers across all sectors in gender and sexual diversity. training of trainee nurses, police officers, teachers, and medical and law students in gender diversity and sensitivity and inclusion before they venture out into the service industry. Also, there should be non-discriminatory policies at institution and redress mechanisms where people have a sense of justice and people are held accountable for their discriminatory actions. Amendment of legislation to prohibit discrimination in employment on the basis of sexual orientation, gender identity, and expression. And finally, a recognized need for capacity building and empowerment sessions for the trans community members to address intergroup and interpersonal issues within the community itself. Thank you.
Thanks very much, Alessandra, for sharing the methodology, findings, and recommendations. I'm now going to ask Executive Director of the Caribbean Vulnerable Communities Coalition, Mr. Ivan Cruikshank, to provide some reactions, some responses to the findings of the research. So Ivan, if you can unmute your mic, and everyone on the Zoom call and us here in studio will be able to hear you.
Is not altogether new, but somehow I think it confirms or reaffirms in our mind that we need to focus on moving forward. One is the critical need for localized research or data to understand the needs and challenges of trans community at country level. And so I'm happy that Guyana started this process, and therefore you guys have some what I would consider to be robust data to inform policy and program advocacy and interventions. Another thing that the study jumped out at the study from our end, and which we are very interested in pursuing some further discussions around, is just helping the community to have a better sense of the concept of gender identity and to be able to help them to own that gender identity. Because I think that was one of the big issues that came up, and I think across the region, that is something that we are seeing as well. The other thing that is important to note is the need for us to be able to provide a supporting environment for professionals to deliver gender-affirming, comprehensive responses, not only in the area of HIV, but also in terms of other social services and medical services to key population group, and in particular, the trans community. And I think this study has offered some very useful recommendations which can be translated to other country interventions. Another thing which the study clearly pointed to, which is a critical area for us to address, is the issue around violence, discrimination that the trans community face in general, and the high incidence of PLHIV or prevalence of HIV among the trans community, which is something that we have to pay very, very keen attention to and identify very substantive intervention to address both violence and discrimination, as well as the incidence of HIV in the community. So for us, being part of this intervention, this study, provides us with a very, very good framework for rolling out similar type of interventions. And as you know, Joel, we had worked with the trans community over the last 2 years in the establishment of UC Trans, which is the United Caribbean Trans Network, and we're working very closely with them to see if we can develop a comprehensive set of responses, not only to their HIV needs, but to their general well-being and life needs. And so I am very happy that SASOD began this process, and we're very keen to support the rollout of this methodology in other countries. So on that note, I would now thank you and revert to the rest of the members on the call.
Thanks very much, Ivan. I think at this point, it would be useful to... Well, I wanted to highlight a couple of other things before I go to the questions from the media corps on the call. I just wanted to highlight a couple of products out of this project. For us at SASOD Guyana and GTU, this is really action research. And this work certainly does not end with gathering this evidence and letting it sit in a report. One of the deliverables of this particular project, based on this report, we developed an action plan, a very detailed action plan which was organized thematically, and we listed the stakeholders that needed to be engaged to address these issues. We separated the actions into short, medium, and long-term actions. We decided who needed to be involved, and we've already started to actually engage some of the stakeholders, including the National AIDS Program Secretariat, around the issue of access to HIV services especially. So that was also that's also a very important, I think, outcome of the project, which will go on for some time as we work with various partners to implement some of these recommendations like Ivan shared. In addition to that, one of the early outputs was a rapid review of all the literature related to trans issues, which was very limited for Guyana and the Caribbean. So I'm happy to hear CVC indicating that similar work could be replicated across the Caribbean with other trans communities. And the third aim I mentioned for Trans Day of Visibility, but didn't really go into, and I want to acknowledge this too. One of the outputs requested by the Global Fund specifically was for us to write up this project as good practice. Good practice in the sense that it involved, in meaningful ways, transgender-led organization, and one of the two research consultants was a qualified trans person from the local community. And part of the goal around Trans Day Visibility is celebrating the contributions of trans people to our world. Later today, you will see on the SASOD Guyana social media, we'll be rolling out our hashtag 592 Trans Role Model campaign, in which for the next 7 days or so, we'll be highlighting at least one per day, transgender role models in Guyana, who other trans people could look up to, and celebrating the contributions of those trans persons to Guyana and to the community in general. At this point, I will ask our colleagues on the call if they would like to ask any questions. Just remember to unmute your mic. I'm going to ask my colleague Kobe to be close by in case we might need to have the question repeated or anything, but so far it seems like if the sound is good from the laptop. So over to the media colleagues who are on the call that might have particular questions. I see some indication from newsroom. Is another? Are you here? for some reason we can't hear you, so I'm going to ask if you could type your question on the message box, which you seem to be doing, or alternatively, if you could send your question to me in WhatsApp. You seem to be talking, but for some reason we can't hear you. I think it might be the audio on your end, since we're at least able to hear the folks on CDC. So Isabella, if you're hearing us, can you type the question or send it to me in text via WhatsApp?
Question can be.
Just type in. All right. Very long question. Did it come true?
No. So okay, I'm not sure if you mentioned it or not, right? I may have missed it, but how long was the study? How long was the study?
We did mention that. Thanks, Isabella, for that question on methodology. Is another pastoral from newsroom is asking how long was the study? 3 months. We started in January 2020, and we concluded in March. We just recently concluded with the publication of the report today. So it was a 3-month study. Any other questions from my other colleagues on the call? Remember to unmute your mic. I can't see from this angle who else is on the call, so I'll just call the people that are supposed to be there. Do we have Dennis from Demerara Waves online? Dennis Chabral from Demerara Waves is online?
Otis. Sean Embrock.
Sean Embrock, I don't know which media house you're from. I don't recognize your name. But do you have a question? Somebody else seems to be typing.
Sean, Newstalk Radio. So Sean, Newstalk Radio Guyana. For the case studies, how many persons were involved?
22.
He's asking the sample size.
And somebody don't answer. It's who answered?
Responded 22.
Well, Sean, you got your answer. We will ask Alexander to say a bit more about methodology since you seem to be interested in that.
Hi, good morning. So the study utilizes a qualitative methodology, and semi-structured interviews were conducted with 22 trans or gender non-conforming persons from region 4, 3, 5, and 6 of Guyana. 18 of those persons were trans women, 3 of them were trans men, and 1 person identified as gender non-conforming.
We should also add that there were 4 stakeholder interviews, key stakeholder interviews. So we had interviews with 2 legal experts and 2 medical experts as well, in addition to the 22 trans persons. Yeah, it's 22 trans persons. So I think SASOD's communications volunteer is asking me, Otis Chase, who's also on the call, is asking a bit of a question, a bit of a technical question directly about how representative you would say the sample was in your assessment.
So based on the present geography of the trans population in Guyana, I would say it's pretty representative, given the fact that we don't have a lot of people who self-identify as trans men. So even though you may be saying, oh, it's just 3 of them out of the 22, sorry, I think it's representative of the amount of persons who self-identify as trans. And as you mentioned, Joel, it ties into more technical issue relating to gender and sexuality, because what we find with the lack of education, you have a lot of people who identify as lesbian, and who are butch or masculine in their expression, but through education then they say or realize that they're more trans-masculine. So because of the lack of education, we don't have a lot of trans men who self-identify as trans men. Some of them are still observed within the lesbian category. So the sample is very representative based on our present population, how people self-identify.
Thanks, Alessandra. I'm going to continue to call out people because I don't know if they have questions. We should have Dennis Glasgow from News Source on the call. Is Dennis there? And feel free to speak if you have questions. I'm not mandating you to type the question.
Dennis here from News Source. My question is just really about this study. If you, of course, you guys may be sending a copy out, but how can we get this the video recordings from you guys from this press conference?
All right, so we're going to send this directly to all based on request. Dropbox, OneDrive, whatever mechanism. Immediately after the call, UG Center for Communication Studies is going to download and we're going to be able to upload and get it to you. So you'll definitely get the footage, Dennis, and photographs as well. Also, the full study will be sending out PDF copies immediately after the call, along with the presentation that Alessandra made. Did I cover it, Dennis? Dennis, you still with us? Okay, good. Thanks. Okay. Is there anybody else who's on the call? Somebody from Starbucks News is supposed to be on the call. Somebody there? Anybody from Starbucks News identifying themselves? And the last person I was told to expect is Abina Rockcliffe from Guyana Standard on the call. Abina Rockcliffe from Guyana Standard there? All right. I don't know if I'm missing anyone, but does anybody else have any additional questions?
In the chat.
Well, there's a question in the chat. Can I get some assistance from our field to read out the question?
I think we answered this question earlier. The one with, I may have missed it, but how long was the study?
Okay.
Yeah,
I think that was one, the first or second question we took. I think we covered it. Is another? Did we cover
Oh,
your
hold on,
question?
wait.
There's an additional
There's
one.
another question. So is there an average of how many trans persons there are in Guyana?
Oh, question on population size estimates. I'll let Alessandra answer that question as well.
So I can't remember the year. Was it 2017?
2018.
2018, SASOD in collaboration with Measure Evaluation did a population size estimate, actually a key population size estimate to estimate the size of men who have sex with men, trans persons, and sex workers in Georgetown, in Region 4, sorry. However, some of the limitations of that size estimate is that they would have estimated trans women that you could possibly meet through HIV services, through outreach activities, and not all trans people you would reach through outreach activity. So that's one of the limitations. The other limitation is on the USAID programming, trans men are not considered key population, so the target was only trans women. So trans men size estimate was excluded also from that study. Generally speaking, we don't have a figure of the size estimate of trans in general, including trans men, trans women, and gender non-conforming people across Guyana. It's something that the Guyana Trans United and SASOD has been in conversation along with GAIBO, who is our sister organization, to conduct a nationwide survey to have a general estimate of the size of the trans population, which would include trans men, trans women, and gender non-conforming people.
Thanks for that, and I think that might be an area where CVC might have some interest. I know CVC has a lot of experience doing population size estimates in the Eastern Caribbean, in the OECS states in particular. So I think that's also another area for collaboration and future work on which the local organizations can engage CVC given that expertise in the Caribbean. Are there any other questions? Feel free to unmute your mics. If not, you can type them in the chat. I'm not getting any indication that there are other questions. So I think we could I could start to wrap up and bring the virtual launch to a close. Just to share a little bit that I mentioned about the action plan. It's way too detailed for us to go into all the areas. It's like 5 pages. But I at least wanted to share some of the thematic areas. We'll also send the action plan out to the media. Also, some of the thematic areas that it covers. So HIV Services and Healthcare is obvious one, including the national HIV response and inclusion of trans persons in global fund processes. Gender-affirming care, specifically working with medical providers on providing gender-affirming care. Legal services, which is an area that still needs to be expanded. Access to education, some of the socioeconomic issues are covered as well thematically. Employment and entrepreneurship opportunities. Access to public services and spaces. We spoke a little bit about the discrimination that often occurs in accessing public space and public services. Organizational changes, and that term is used broadly at the level of community-based organizations, civil society organizations, government institutions, in particular state agencies, and even donor and technical partner agencies about how they deal with and include trans issues in their programming. And I think those are the thematic areas covered by the very detailed plan of action that stemmed from this piece of action research. All right, I want to thank everyone for joining us. It's so hard for me to look at this camera when this laptop is over there. I want to thank everyone for joining us for our very first attempt at having a virtual media conference. As promised, we will be sharing the documents, the full report, Alessandra's presentation, the action plan, photos and video footage with our media partners immediately after this call. So we'll be in touch with all of you directly who have participated to make arrangements to get you the materials that you need for coverage. And we really do appreciate your time amidst the circumstances of COVID-19 for joining us virtually. I mean, this pandemic is affecting all groups, and certainly one of the most vulnerable populations affected by any health epidemic, especially this one, is the trans community. So we're still glad that we had the opportunity to, in some small way, celebrate an achievement of organizations working for the rights of trans people, that we're able to highlight and showcase a good practice of meaningfully involving the contributions of trans Guyanese in our societies, and also to remind you to look out for our hashtag 592 Trans Role Model campaign, which begins today and rolls out for the next week. Thank you all very much. I want to thank my colleagues, Alessandra Hiriman, my colleagues from CVC, Ivan Cruikshank and Camille, who are on the call, our communications volunteer, Otis Chase, who's also on the call, and everyone in-house here at SASOD Guyana and the University of Guyana's Center for Communication Studies. Thank you all for joining us.